Technical Veterinary Learning Channel, honored by Professor Ahmed Mamdouh Sharif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-Vice Dean of Faculty of Veterinary Medicine, Bani Suef University, Egypt, presents today series of epidemiology to be completed. The sixth and last part of the lecture about principles of prevention and control of infectious diseases. In the fifth part, we spoke about vaccination, and in the beginning of this sixth part, we will speak about the quarantine. Quarantine means the isolation of animals that are either infected or suspected of being so, or isolation of non-infected animals that are at risk. This done in infected farms or infected areas, or when new lot of animals come out the borders of the country. Uses of quarantine. Number 1. Isolation of imported animals from exotic areas, naso areas, or even free areas. The second use is isolation of animals suspected of being infected during epizootics. During quarantine, the infected individuals are isolated on one side, while the susceptible animals for infection are quarantined in the other side. It is important to apply quarantine whenever there is risk of introducing infection from animals exposed at the point of origin. Quarantine measures may be applied at herd level, regional level, or national level. During quarantine, extensive laboratory testing is carried out for detection of previous exposure to infection or carrier state for diseases that not reported or enter to this area. Imported animals are usually placed in quarantine stations for a defined period, usually the maximum incubation period prior to being transferred to a property of the purchase. This to ensure that these animals are free from diseases that not reported or exotic in the new farm or new zone or new country. The period of quarantine depends on number 1. Incubation period of the disease, such as quarantine of a dog who bitten another animals or man. This done for about 14 days, which form the incubation period of this disease to be appear as clinical signs on this dog if it is infected already. Number 2. The time taken from infection to be confirmed laboratory. Number 3. The time taken from an infected animal to become non-infected by passing the incubation period time or by it changing from infected animal to sound one. Countries which have land boundaries with their neighbors should notify each other through the International Office of Epizootics in Paris, OIE, about the disease status of their livestock to protect each other from emerging diseases. Herd segregation. Done when an outbreak occurs in a herd, it is useful to segregate the animals into two groups. The first one, those with evidence of infection, and the other one are those without evidence of infection. For herd segregation, first segregate young animals from older ones because the young animals are more susceptible to any disease. Number 2, the immunized animals may be placed closest to the non-infected animals to act as a buffer between the infected and non-infected animals. The third steps in the principles of prevention and disease control is the environmental and the management control. The ecological imbalance between the host and its environment usually results in disease occurrence. Reducing the severity of such imbalance will result in reducing the level of diseases through number 1, improving of the physical environment in partners by means of keeping of optimum ventilation and lighting. Number 2, physical cleaning of animals and their environment. Number 3, the premises, sheds, stables, and kennels and pastures should be prevented from contamination. Such sanitations are very important for controlling respiratory and fecal-oral infections. Number 4, elimination of parasites from the host at the most appropriate time by use of parasiticides therapy to preventing pasture contamination. Number 5, pasture rotations between specific and non-specific hosts to prevent gastrointestinal tract infection. Number 6, carriers of diseases in the herd should be diagnosed and eliminated so that the herd may be completely from diseases we didn't want. Certain diagnostic screening tests can be used for spotting out carrier animals in the herd, such as Ross-Bengal tests, Malin tests, tuberculin tests, and so on. These tests should be periodically conducted on all animals in the herd so that carriers can be diagnosed and culled. Some of these diagnostic screening periodical tests have to be done under certain veterinary authorities. Series of epidemiology with another subjects will be continued in the coming days.